On Friday afternoon, I got a letter from a Dr Fergal Ruane. Fergal is a GP based in Belmullet, and he sent me a copy of a letter which he has written to the Minister for Health, Stephen Donnelly. He's also sent copies of the letter to people like Dara Calleary, Rose Conway-Walsh, Alan Dillon, Catherine Donoghue, the General Manager of Mayo University Hospital, Siobhan O'Sullivan in the HSE, and to the media, as well as to the managers of Ballina and Swinford District Hospitals, and to Mary Noon, who's the Director of Nursing at Belmullet District Hospital. And I want to read you very quickly the letter that Dr Fergal Ruane has written to Minister for Health Stephen Donnelly. He says, "Dear Minister, as you're aware, I recently shared pictures of the distressing outcome for a patient of mine who developed an ulcer on his leg as a result of catheterisation for acute urinary retention. This 95-year-old man normally lives alone independently. He has support of home help. In normal circumstances, my clinical practice would be to admit this man to Belmullet District Hospital for management of this problem. Due to current issues in the hospital, this was not possible, so I elected to send him to Mayo University Hospital, an entirely inappropriate setting for his problem. He was not admitted, rather he was catheterised there and then discharged home. Predictably, he ran into trouble. Since discharge, he has had 2 trials of void, which were unsuccessful, and he now has a catheter which will likely remain in place until he is seen urgently by the urology services in Galway. The wait for the overstretched urology services there can be quite prolonged. Frustratingly, this man had an identical presentation last February. At that time, he was admitted to Belmullet District Hospital, managed there for 5 days. His catheter was removed successfully and he remained quite well and lived independently until this presentation. This morning, a 90-year-old man presented with the exact same problem and social circumstances. I had little option but to let him go home with his quite distressed daughter. In the last fortnight, 2 other patients with other problems that would be appropriately managed at Belmullet District Hospital are struggling at home. This situation has arisen due to years of underinvestment in our local hospital. In my mind, and in the opinion of the people of Erris, this is deliberate, and despite building plans having been drawn up, there is little intention that I can see of any significance of the advancement of the situation, and the hospital is being wound down. The current coronavirus epidemic seems to be the latest excuse to delay investment. I'm told that restrictions due to the risk of introducing COVID to the unit are the current limiting factors to direct GP admissions for patients. Patients are admitted only as step down from other hospitals. At the moment, there are 12 inpatients, a massive underutilisation of available spaces and nursing staff. This has a knock-on effect on Mayo University Hospital, Ballina District Hospital and Swinford District Hospital, who have to take up the slack, and also onto the also overstretched community nursing services. And he goes on to say, it seems obvious to me that a small investment into interim emergency measures to upgrade the hospital could be relatively easily put in place to upgrade infection control measures to increase bed capacity. It is also obvious that in an underutilised facility there must be space to isolate and test admissions to prevent introduction of COVID or any other infection for that matter. And he finishes by saying, following this holding measure, further plans and funding need to be put in place urgently to provide this service to a geographically large area with a high proportion of elderly people frequently living alone and generally independently. Michel Lemas, and that is Dr Fergal Ruane, telling the Minister and others about his dilemma as a GP down there in Belmullet. Rose Conway-Walsh, good morning.
Good morning, Tommy.
You're a public representative for this area. I know you're not in government, and you'll say if you were, you would pull out all the stops. But the reality is that as you know, let's take the infamous collective responsibility here, all the TDs in Mayo flying the Mayo flag. What have you to say about that letter?
Yeah, well, firstly, I want to thank Fergal Ruane for writing the letter. I think it's enormously important that communications come from directly inside the system, and I would encourage others to do the same. Now, you'll know that I have raised this with the Minister on many occasions. Now, we could go back 10 years when the beds were cut from 40 to 20 in the first instance. And I agree with absolutely every word that he has said, because nothing has ever happened along the journey that has convinced me any different than their absolutely intent in closing Belmullet Hospital. And there's no accountability whatsoever. The nonsense of referring patients up to Mayo University Hospital when they don't need to be. Firstly, it's the complete ignoring of the GPs and the clinical expertise of GPs when they see fit that they can treat them safely and effectively in Belmullet Hospital. Now, they can't even use capacity as an issue, because if it's the same patient, so it's the same patient coming from Mayo University Hospital as it would be referred from the GP, the same resources that would be required. There's just no accountability within the HSE. There is one manager after another, and it'll take complete reform to address that, and a minister that will stand up.
And money and a budget.
Well, a budget as well, but the budget has to be targeted in the right place. Now, the budget for Belmullet Hospital, there are minor works to be done there, which they have dragged their feet on, not within Belmullet Hospital in itself, but in the whole nonsense between maintenance being done for Mayo University Hospital, and then you had the whole case of the court case and everything that was around that last April. It's a quagmire of disaster and incompetence, complete incompetence, as well as the funding that's needed for the capital investment into the hospital. I don't mind, Tommy, if someone gives me an explanation, and if somebody said, right, Rose, this is the reason why the patient has to go from Belmullet to Castlebar down again, I will listen to any pragmatic explanation. But they won't give an explanation. So when I raise this, and I raise this in the Dole, and they will say they'll give a vague answer or not answer the question at all, as in most cases. So you have to keep following them and following them and following them. Now I know, because I've had conversations with Darragh Callery around this as well, that he is on the same page as me in regard to Belmullet Hospital. Now he's in a better position because they are in government with Fine Gael, and I am pleading with the TDs in Mayo that are in government. They are in government. They are there to listen, to read that letter, to read every line and every word in that letter, because it's true. And this is what's happening. And the Minister is aware of it, the Taoiseach is aware of it, they're aware of it all the way up along the line. And they need to be accountable, and they need to do what's sensible. I'm scared out of my life. I raised this yesterday, even on A Week in Politics, around the lackadaisical attitude that there's been from the HSE in preparing for a second wave of COVID. You know, Belmullet, and this is a case in point of it. Belmullet Hospital could be used there, fine, big hospital, room to social distance, infection control, and all of that, and yet they haven't done it, nor have they done the modular unit yet within Mayo University Hospital. They would rather see the trolleys lined out to the shop in Mayo University Hospital than to do the common sense thing and have people who are able to be treated in Belmullet Hospital treated in Belmullet Hospital, because they're hell-bent, I believe, in closing the hospital down.
Okay.
And I'm sorry to be good, but I just get so angry, Tommy, because this has been going on for so many years, and the way that people in rural areas are treated continuously. And I am fighting it every single day. I'm fighting it. And I'm asking the other TDs in the county to use their positions in government, because that's what I would be doing if we were in government.